This video is about one of the common questions that patients ask when they're looking into the origin of their persistent pain. Watch the video to understand a little more. Hi, I'm Drew Coverdale, physiotherapist and author of The Pain Habit. I talk about all things pain and help patients change and let go. We're going to cover in this video that question that people ask when you start to discuss the origins of persistent pain. And sometimes they might pose the question, are you saying that the pain is in my head? Many people see well-meaning medical practitioners, physios, doctors, osteopaths, nurses, and are given a clinical impression or medical diagnosis. And unfortunately, they're left with the impression that the pain is in their head. They're left feeling that it's in their imagination, it's not real, it might not fit with any recognisable medical condition, and they may be told that nothing can be done about it other than live with the pain. Quite often, because the information given by that practitioner is based upon the fact that what they've seen in their assessment or how you responded to the treatment is left falling outside the scope of what they can help you with. They may have tried and failed, and so have you. Or after an examination, they might have even told you there's no point trying anything else. That puts you in a really difficult situation for someone not to believe the pain you're in, or not to be able to find a reason for it medically, or even to give you a diagnosis that then means they think you have to live with that pain. To even suggest to you that your pain isn't real or is in your head when you experience it every day is something that it's quite understandable to feel upset about at a time when you need to be listened to and need to find the answer to your pain. To be told that there's nothing further can be done, or to be told that it's in your head, or to be told it's down to a condition that nothing else can be done, can leave you in a feeling of desperation. It's natural to feel helpless after seeing so many people for so long and not finding that answer. Sometimes you have to wait so long to see a certain person of authority that you're looking to get that answer, and then to be told that it isn't something that they can help you with can leave you feeling helpless. Your pain is real, you feel it every day, and you simply want someone to help you with it. Who's to blame for you being in that situation? Is it your fault? Is it the practitioner's fault? Is it the people's fault who led to you being in the situation that you feel the pain you're in? It's actually no one's fault. There's a way to reverse the whole process. It's not the fault of the clinician. They don't have the intent to cause you any harm. Neither do they have the intent to say things that might lead you to stay in persistent pain. And that's despite you feeling dissatisfied at maybe some of the outcomes of appointments that you might have had in the past. It's certainly not your fault. You're simply expressing the pain you felt, where you felt it, in a way that hopefully triggered the help for that pain that you desperately needed. You're describing the impact it has on your life. You want help and they want to help you. However, it's the misunderstanding of your pain, both by you and the medical practitioner assessing you or trying to treat you, that leads to the futile outcome of failed treatments, failed interventions and ongoing pain. Even if they started out with good intentions, with a certain procedure, pills or techniques, once these procedures fail or only offer short-term relief, it leaves you back in that office with no further options with that person. You're likely to have seen so many people in your search for a resolution of persistent pain. Each failed intervention or attempt at recovery leaves you more frustrated or fearful of the long-term outcome from the negative outlook that develops from the more people you see and the longer you fail to respond. And eventually, once a certain name or label is given, that's almost the point at which you resign yourself to living with persistent pain and slowly shut yourself down because of that label. You might limit your life because of it, or you continue to fight against the pain, or you carry on as best as you can despite it. And often people come to the end of the line in terms of management of conventional treatments and approaches and end up in some form of pain management program. And often beyond that, they simply manage their pain for the rest of their life. They're provided with strategies that might temporarily help and other bits of information, but generally there's an acceptance from many involved that that person has to live with their persistent pain. It's a depressing resignation that happens all too often when recovery is actually possible in that person. If they only understood the true meaning of their pain. If you can discover that, understand it, and act in a way that starts to reverse the process that caused it, recovery is possible. There's this thing about explaining pain to people now in clinical practice that quite often is very technical, and it might be giving the nuts and bolts of how pain becomes persistent or chronic. It might describe what's happened in the brain and the body to create that situation. But to understand that kind of information when you're in pain, it actually takes the thinking part of your brain, and when you're in pain, the blood's not flowing in that part of your brain as well as it should be, so it makes that information just sound like noise. So pain neuroscience education, PNE, is quite a commonly delivered information package at many pain clinics now, but it's quite a technical set of facts. It is delivered by practitioners who understand the broader picture of pain and genuinely trying to pass on that understanding to patients. But one issue with that approach is it doesn't offer the patient the meaning specific to them, and it's the true meaning behind a person's pain that will unlock the pathway for them to reverse it. That pain neuroscience education can be given one-on-one or in group settings, but even in a group setting, you've got a group of people with totally different stories. They may have the same condition causing the pain, but they've got totally different stories to that entry point, and it's understanding the individual story that will help the practitioner and the patient understand the meaning of their pain. And that doesn't always happen when you're just being given a series of facts about the technical issues about how pain develops. So delivering this kind of information is all well and good, but sometimes it misses the point. It's got to be given in a way that the patient can relate to and understand from their perspective and their specific story. If I gave you the analogy of understanding electricity, it might be quite interesting for some to understand about volts and amps and circuits. But if all that person's really interested in is knowing where the light is and that they want to press the switch, then having all the facts about electricity is pretty much useless. They just want to be pointed in the direction of the switch and maybe aren't interested in how it works. I can't emphasise enough how important it is for the person to understand the meaning of the pain. That's pointing out the switch, and then they still have to do certain things to press that switch, but it shows them the route out of persistent pain. So your pain is real. It's as real as any other physiological change in your body. It's like blushing, it's like nervousness, it's like sexual arousal, it's like fear and feeling the hairs on the back of your neck lift in a situation. All of these are physiological changes that happen but are triggered by what happens in your brain. Then that is expressed in your body, and pain is exactly the same mechanism. At some point in time, your pain has become intertwined with emotions, so that the emotion you felt at the time you originally felt the pain, and maybe other cues that were present around that time, now become cues for your brain and body to trigger that pain, long before there's any new damage and long before there's any new injury. These associations that develop without you even realising they were developing, they develop in the brain and are felt throughout the body. The brain is the body and the body is the brain. Your pain has become a habit. You have habitual ways you think about it, the way you breathe, the way you move and the way you feel. And that cascade of activity triggers your pain every time a certain cue, whether you recognise it or you don't, appears in your life. It's an habitual process and you can reverse the habit. If you can hold on to that idea, if it's a new one, that your brain and body work together to protect you, but sometimes become overprotective. If you can hold on to this new idea of your pain being linked to emotions and other cues, and not down to the damage that you've always believed you have to live with, then it gives you the opportunity to do maybe a little bit more research, be a little more curious about it. And that can be the opportunity when you start to look for ways where you can reverse these connections and cues, change the habits that you don't know you even have, and start implementing new ones that put you on the path to recovery. My name is Drew Coverdale. Thanks for taking the time to watch this video today. Now take a little more time out for yourself to plan the next step in your recovery.